Okay, let's have you sit up straight for me. And I want you to just look down at the end of the room there for me. That's perfect.
Dr. Dan Durrie, founder of Durrie Vision, is recognized as a leader worldwide in the field of laser vision correction.
And is it clear now with this first one?
He helped develop the technology that's used today for LASIK procedures on the cornea, as well as the newest way lasers are used, in laser lens replacement. The surgeon no longer uses a scalpel. Instead, a state-of-the-art computerized laser makes perfectly precise incisions in about 45 seconds. Experts in the field of vision correction call it the biggest breakthrough in more than 20 years, and patients are rapidly signing up.
All of our patients, when they come in, they all want the same thing. They want the best vision possible. And yours look great. This is a flash bulb.
And because he doesn't want his own vision to deteriorate, today Dr. Durrie himself is the patient.
Today I'm actually having my lens surgery done. And I had laser corneal surgery in 1999 because I was starting to need reading glasses and I was getting farsighted. So I was able to have my farsightedness corrected, and I've had excellent vision. But all of a sudden I had another birthday, and what happened is I really noticed this first around Christmas time when I was trying to put the Legos together with a grandson and couldn't see. And all of a sudden these little things started creeping back in. And you know, I'd gotten rid of these years ago, and these are a real nuisance, you know, to the point where I can see, and I can see with reading glasses, but it doesn't fit my lifestyle or even my practice. I've got to read all my numbers and things, and in surgery I see great, and my distance vision is still great, but I've gotten to the point where I know now that I'm going in the wrong direction. And then I went and had my appointment, went in and saw Dr. Stahl, and he says, well, it's not your cornea, it's your lens, and in the diagnostic things that we do, it's very obvious that we can tell when the lens is needing to be replaced.
Well, your job's going to be just to hold still and look at a light?
Dr. Jason Stahl, an expert in laser lens replacement, is performing the surgery.
Dr. Stahl's been working with me for the last 10 years. When he was doing his fellowship and kind of looking forward in the future, he really saw that the future was going to be in lens surgery, not just in corneal surgery.
All right, see you soon.
He's become recognized worldwide and by his colleagues and everything as somebody who's always the most advanced in this area. Whether that's in the diagnostic workup and the technology he does, in the office, what surgical techniques he uses, how he follows his own patients, which is kind of one of the things that a lot of surgeons will say, well, I'll take out your cataract, but go back to another doctor. He has the same philosophy that I do, that we're going to really manage your vision. Long-term vision for a lifetime is something that we talk about all the time here. And so I really like his philosophy, and so it's recognized by a lot of his colleagues too. So a lot of people come here to learn. A lot of people come here to have their own surgery too. So I'm not the only ophthalmologist who thinks about this, when they're going to have it done, who's going to do it.
Well, Dr. Durrie had LASIK years ago to give him blended vision to help him with his ability to focus at near so he could throw away his reading glasses. And he did well with that for quite some time. He needed LASIK in his fellow eye to help him with his distance vision approximately 6 years ago. And he had recently noticed that his near vision was fading. He was needing to pick up reading glasses again. And when we examined him, we saw the reason for this was the natural aging changes that happens in the lens. It's called the dysfunctional lens syndrome. And not only did he lose the ability to zoom or accommodate to focus at near, his lens started to develop a little yellow discoloration, which is called nuclear sclerosis. And this scatters the light. It doesn't allow it to focus as clearly as we'd like. If you allow this to progress, it does affect not only visual quality, it can start to affect color perception. Eventually it can reduce visual quantity, and if you let it go long enough, it becomes a cataract.
It was clear Dr. Durrie needed a refractive lens exchange to remove his dysfunctional lens, providing him with a better quantity and quality of vision. The procedure has 2 steps. First, a computer precisely measures every contour of the eye. Then it determines the perfect location for each incision. A femtosecond laser, that's a laser operating at 1/4 of a second, makes the cuts in a mere 45 seconds. Dr. Stahl and his team then move the patient into a second room.
Glare straight ahead would
That's where the new lens is implanted.
And the beautiful thing about having the artificial lens is it's not going to age. He's not going to worry about needing cataract surgery down the road. This is going to stabilize his lens optics, and so as long as the rest of his eye stays healthy, he's going to see well for the rest of his life.
No surprise, all went just as planned. Dr. Durrie receives his patient instructions.
I am done.
And is off to recover. Just days later, Dr. Durrie sat in church with his family, looked up, and noticed the brilliance of the stained glass in a way he hadn't before.
I'd heard from patients that whites were much more white and less yellow colored, but it's really the blues and the pinks and the other things. Looking around at outside and looking at colors, they're much better out of my new eye than my other eye, and I didn't notice that because as lenses age over years, they turn kind of yellow and filter out all the colors, and it just really is so much brighter.
He's 1 week out from surgery, and now Dr. Durrie can give his patients a first-hand account of what to expect when they have laser lens replacement.
Oh, doing fabulous, and the whole surgery was very easy. You know, I know awful about this, but I was surprised at how easy it was. I didn't take any pre-medications or anything. I just went in and did what they told me. They gave me some sublingual medications that I think relaxed me a little bit, but I wasn't nervous, so I don't think I really needed very much. But you talk to the nurse anesthetist, and everybody comes by and asks you whether they can help you in any way, and I was very comfortable. So I didn't want to miss it either, so I didn't want to be too groggy. So I wanted to kind of watch so I could tell patients what it's like from my side. People want to know whether it's going to hurt, and no, it doesn't. The little thing that holds your eye open is a little weird, but you know, that's something that's easy to put up with. There's really no sounds. There isn't really any buzzing sounds or other things. It's all pretty much just watching the lights. Very reassuring voices, you know, somebody there to hold your hand, and it makes you very comfortable. And the staff is so professional, they know what they're doing, so it gives you that real comforting feeling. And I was very proud of all of them.
You gave me 2.
But does his new eyesight stand the Lego test? You bet it does.
Joshua said this is a snake side.
Yeah, it actually is.
My generation, the people that are turning 55 to 65 now, are redefining a little bit how we take care of ourselves. Like I like to say, we're not growing old gracefully, we're putting up a war. You know, and we don't get dentures, we get dental implants, we don't get a cane, we get a new knee, we don't get cataracts, we get the fancy lens implants because we want to. Losing your vision is unnatural, getting it back is very natural. It's just kind of the way it should be. Okay, it goes across there.
If you'd like to know more about laser vision correction, please visit us at laserlenscorrection.com.